after delivery, you and your newborn are now ready to open a new page and begin a new chapter together. Congratulations, Superwoman, for making it this far. I am so proud of you. But once you get home from the hospital, you might feel like you have no idea whatsoever you are doing. So I've made these guidelines to help you, especially the nervous first-time parents, to feel confident and positive about caring for a newborn. In no time, in this video, we are going to take a look at 8 important topics that relate to childcare. First on the list, we are going to take a look at how and where to get help after delivery. We will also look at how to handle newborns. They are so fragile, and so a lot of care needs to go into their handling. We will take a look at that. We also look at bonding with your newborn, and we will look at diapering as well. We will also take a look at bathing basics. We'll take a look at circumcision if you have a male born. We also take a look at umbilical cord care, which cuts across both the male and the females. We will look at feeding and burping. And last but not the least, we are going to take a look at sleeping basics. So first, where and how do you get help? I want to tell you that it is okay to get help during this time, which can be very hectic and overwhelming. There are 3 types of help you can rely on. The hospital is the first one, home services, family and friends is the third one. At the hospital, while you have not been discharged, talk to the experts around you. These people are well trained and they are there to assist you. So ask all your questions. Ask for help. You can ask your midwife to help you with how to hold your baby, how to pep your baby, how to feed your baby, and how to care for your newborn in general. They are there to help you. You don't have to do this alone. You can also rely on home services when you are home for help. You may consider hiring a baby nurse or look around your neighborhood and get a responsible teenager to help you for a short time after the birth. Let's say about a month or 2. If the person is free, they can come around to help you with household chores while you concentrate on taking care of your newborn. It will ease a lot of burden on your neck. You can ask around too for recommendations on which agency is better in doing these services. You can also rely on family and friends. I know that when you deliver, there are relatives and friends who often want to come in to give their helping hand. Though you may disagree on certain things, but I want to tell you that don't dismiss their experience entirely. But if you won't feel comfortable having guests around, that one too is okay. You don't have to feel guilty about it. Now let's take a look at the second one. Handling a newborn. If this is your first time and you haven't had time or chance to spend a lot of time around newborns, then you are going to be intimidated. I should tell you, they are so fragile and sometimes it feels like they are going to break. But following these steps that I'm coming to talk about, you will remember them because they are very basic. Will help you in handling your newborn. 1. Wash your hands. These newborns don't have a strong immune system, so you don't want to expose them to infections. So make sure that either you or whoever handles your baby has clean hands. You don't have to feel bad about telling people to wash their hands before handling your newborn. This is your child. My dear, do what is good for you and your baby. The second thing to note is support your baby's head and neck. When they are new, like a week to a month to 2 months, their neck is not strong enough to support their head. So when you lift them up, you have to hold their head, put your hand at the back of their head to support their head and their neck, just as this woman has done. And third, never ever shake your baby. or throw your baby in the air. They are not ready for such games. They are not ready yet. Shaking your baby can cause bleeding in the brain, and it can even cause death. So whether you are playing with your baby, or you are frustrated, or you are annoyed, never ever shake your baby. Keep this in mind. If you need to wake your baby up, you don't have to vigorously shake them and wake them up. Instead, you can blow a gentle air on their feet or on their cheek. That will wake them up. Just try it and see. If you are still watching up to this point, I want to ask you that please subscribe to my YouTube channel or follow me on Facebook for more of my content. Now let's move to the next one. Bonding. How do you bond with your newborn? Okay, there are 3 ways you can do this. Through touch, you can do that through music, and you can do that by swaddling your new one. So let's take a look at them one after the other. Touch. Probably it's one of the pleasurable parts of infant care. It should start as early as their first hours, and this after birth. So at the hospital, your nurse will give your baby to you and try as much as possible as parents to make a deep connection with your baby. Physical closeness can promote an emotional connection between you and your child. So begin bonding by holding your baby and gently move him or her in different patterns. You and your partner may also take the opportunity to be skin to skin. That's holding your newborn against your own skin while feeding or singing or playing with them. The next way to bond with your baby is through music. Babies usually love vocal sounds. It could be talking, babbling, singing, cooling, and they love listening to music. Baby rattles and music played from your mobile phones are other good ways to stimulate your infant's hearing. If your little one is being fuzzy, try singing, reciting nursery rhymes, or you can even read aloud as you sway or rock your baby gently in a chair. Don't worry, they love repetitions. So continue singing, even if it is one song that you know. But bear in mind that every child is different, so don't forget this. In case your child seems to be sensitive to touch or light or sound and might settle and cry easily or sleep less than expected or turn their faces away when someone speaks or sings to them, if that's the case with your baby, keep noise and light levels low to moderate until you have been able to detect what the actual cause is. Keep noise and light levels low to moderate. Now, the third way to bond with your baby is through swaddling. If your child lies crying, this works magic. It soothes baby during their first few weeks. As a new parent, you have to learn this. A proper swaddling will keep your baby warm and also give most newborns a sense of security and comfort. I don't know why they feel that way, but it makes them feel they are secured and they are safe. Learn how to do that. It's not just this, it can limit reflex, which can make your baby wake up. If you swaddle them well, since they feel secured and comfortable, it will reduce this and your baby can sleep a bit longer. And here's how to do it. Wrap a piece of cloth around your baby like the ones that have been shown on the screen for you, the ones you are watching. This is a swaddled baby. When the baby is swaddled, this is how it looks like. Just wrap the cloth around their body, not too tight so that they can breathe. The fourth topic we are going to look at is diapering. Before you deliver, I know you probably might have decided which one to use, either cloth or disposable diapers. I mean, whichever you use, your little one will dirty diaper around 10 times a day or about 70 times within a week. Oh yes, from peeing to pooping. So before you change your baby diaper Make sure you have all your supplies or things that you are going to need within reach, so that you won't have to leave your infant unattended on a changing table, or if it's on your lap, you won't have to make a lot of mess. So you are going to need a clean diaper, a fastener, that is if you prefer to use cloth as diaper, a clean piece of old cloth, that is if you are not going to use a changing table. This piece of old cloth you put flat on your laps and put your baby on, so that after changing, if he or she has poo-poo, mess will not touch your skin. And because it's a piece of cloth, you can take it and wash it and reuse it. You are going to also need shea butter. I always use shea butter with my newborn after I have changed their diaper. It coats their skin to prevent nappy rash. Nappy rash is a bad experience, so to prevent it, apply shea butter on the skin or the area, prevent your baby from getting nappy rash. You're also going to need a wipe. If the diaper is wet, lay your baby on his or her back, either on a changing table or on your laps, and remove the dirty diaper. Gently wipe your baby's genital area clean. When removing a boy's diaper, keep this in mind and be very careful, because the boys mostly pee when they are exposed to the air. When wiping a girl, wipe from bottom to front. Now let's take a look at bathing basics. Don't stress yourself and your newborn with lot of bathing around this time, especially because the umbilical cord has not fallen off yet, and circumcision, if you have a male child, might not have healed yet. So within the first month or first 4 weeks after birth, just wipe your baby clean and they are good to go. Remember, when they were inside the womb and didn't have any bath, they were just fine. So they will be okay, just wipe them clean. But in case you want to give your baby a bath, then I would advise that you have all the things you are going to need very close to where you are going to clean or bath your baby. You are going to need a clean washcloth, which should be very soft, unscented baby soap or shampoo. You are going to need a soft brush, which you are going to use to stimulate your baby's scalp. You are going to need towels or blankets. You are going to need a clean diaper and clean clothes. Remember to use warm water but not hot water when you are either wiping or bathing your baby. And don't forget to support their head and their neck, because they are not strong and they are fragile. When you choose to give your baby a bath, make sure you gently pat their skin dry before you change their position. You wouldn't want your baby to slip through your fingers. Never leave your baby unattended in the room where you are bathing him or her. If you need to leave and go and pick up something, please wrap your baby in a towel and take him or her with you. After the bath, you can now diaper and dress your baby. I recommend that you feed your baby after dressing up. You could choose the bottle, or you might breastfeed your child. Whichever way is okay. After a few minutes of crying, they will just fall asleep soundly and peacefully. The next point we are going to consider is circumcision and umbilical cord care. Immediately after circumcision, that is if you have a male child, the tip of the genital is usually covered with gauze coated with petroleum jelly to keep the wound from sticking to the diaper that your baby will wear. Gently wipe the tip clean with warm water after a diaper change. Then apply petroleum jelly. I prefer shea butter, but a lot of people use this petroleum jelly to the tip so that it will not stick to the diaper. Please consult your doctor if there's redness or irritation of the genital of your male child after few days of being circumcised. The umbilical cord care in newborns are also very important. Some doctors suggest that you rub the area with alcohol until it dries up and falls off, usually within 10 to 3 weeks. But others recommend that you leave the place alone. You have to talk to your doctor to see which one he or she prefers. Until the cord completely falls off, that is going to change color from yellow to brown to black, and it is normal. There's no cause for alarm. Now let's take a look at our next topic, feeding and burping. Whether you choose to breastfeed your child or go in for formula, you are going to still ask these questions. How often within a day should I feed my baby? Well, it is generally recommended that babies are fed on demand, that is, when they seem hungry. And that raises another question. How do I know that my baby is hungry? Well, I'm going to give you clues to that. Your baby will cry when they are hungry. They are likely going to put their fingers in their mouth when they are hungry, or they are going to make sucking noise. A newborn baby needs to be fed every 2 to 3 hours. Breastfeeding or you are giving formula, just that formula takes a longer time to digest. So if your baby sleeps more than 4 hours without waking up to breastfeed, then please wake him or her up and feed them. That is very necessary. Sometimes as parents, we are concerned about whether our babies are having enough milk. It is easier to monitor formula fed babies. But when you are breastfeeding, how do you calculate that? Well, here are some tips to help you know that your baby is taking in enough milk. If your baby seems satisfied, produces about 6 to 9 wet diapers and several stools a day, sleeps well, and your baby is gaining weight regularly, then he or she is probably eating enough, and that is okay. Another way to tell that your baby is getting milk is to notice if your breast feels full before feeding your baby and less full after feeding your baby. You can talk to your doctor if you have any other concerns on maybe your next visit to the hospital. Babies often swallow air during feeding, which can make them cry. To prevent this, you have to pep your baby often. To pep your baby, hold your baby upright with his or her head on your shoulder. Support your baby's head and back gently with one hand and gently pat their back with your other hand so that they will bring out gas. This is one easier way to pep your baby, especially if you are a first-time mom and you don't have the experience. You gently put them on your shoulder and support their head and gently pat their back and pep them. Or you can equally sit your baby on your lap and support their chest and head with one hand. Use the other hand to gently pat their back. You can lay your baby face down on your lap and support your baby's head, and you can gently pat their back to pep them. Always pep your baby when feeding time is over, then keep him or her upright for about 5 to 10 minutes before putting them down to sleep. This will help them avoid spitting up or vomiting. Newborns sleep between 14 to 17 hours every day, oh yes, but in a shorter interval, like 2 to 4 hours interval. But don't expect yours to sleep throughout the night. The digestive system of babies are so small that they need to be fed in between 2 to 4 hours. So, if your baby do not wake up before 4 hours, you have to wake them up and feed them. At a go, your newborn may not be able to distinguish between day and night. So to help them recognize this, I recommend that you keep playing and talking to your baby to the daytime and minimize playing with them during the night. It is also important to note that you always have to place your baby on his or her back to sleep to reduce the risk of suffocating during the night or even during the daytime. Also, be sure to alternate the position of your baby's head from night to night. First right, then left, and so on, to prevent the development of a flat spot on one side of your baby's head. Even though you may feel anxious about handling a newborn, in a few short weeks, you will develop a routine and be parenting like a pro. If you have questions or concerns, ask them in the comment section. Thank you for watching. Your pregnancy journey was not an easy thing, but you made it, Superwoman. You made it through labor and delivery. So keep in mind that your instincts are going to help you now that you are a parent and a mom. So trust your instincts. If your instincts tell you your baby is sick, probably they may be sick. See the doctor. You are the best mom ever. I am so proud of you. And here is a toast to you and your baby. Enjoy this chapter of your life with lots of happiness and good memories. Don't forget to take lots of pictures because your new one will grow up very fast. Subscribe and see you in the next video.